All right, good afternoon, everybody. Thank you so much for joining this congressional briefing, Protecting Moms and Babies Against Climate Change. I'm Molly Rauch, the Public Health Policy Director with Moms Clean Air Force. I'll be moderating this briefing today, during which we'll have the opportunity to hear from an amazing group of legislators, healthcare providers, scientists, and advocates who are working to alleviate the maternal health crisis in the United States. I want to tell you all that today's event is being recorded and it will be posted and shared after the event. This briefing is the result of a collaboration of a diverse group of partners, including A Better Balance, the Alliance of Nurses for Healthy Environments, the Black Women's Health Imperative, the Center for American Progress, Florida Clinicians for Climate Action, Human Rights Watch, Moms Clean Air Force, the National Association of Nurse Practitioners in Women's Health, and the National Birth Equity Collaborative. Thank you so much to all of these partners. We are pleased to be joined today by Representative Lauren Underwood and Senator Ed Markey, who have been working together to address the maternal health crisis. They are the lead sponsors of the Protecting Moms and Babies Against Climate Change Act. This bill has the potential to improve maternal health disparities and address the health impacts of climate change on pregnant people and babies. And you'll hear more about this bill shortly. We're going to hear first from our speakers with time set aside at the end for any questions. So please put your questions in the Q&A box as we go along, and we'll get to them after all the speakers have presented. In the interest of brevity, I'll introduce the speakers as we go along, starting with our first speaker, Representative Lauren Underwood from Illinois' 14th District. Congresswoman Underwood is the first woman, the first person of color, and the first millennial to represent her community in Congress. She is also the youngest African-American woman to serve in the US House of Representatives. She is the lead House sponsor of the Maternal Health Momnibus Act of 2021, which is a suite of 12 bills that includes the Protecting Moms and Babies Against Climate Change Act. Congresswoman Underwood, welcome.
Thank you so much. Hi, everybody. I'm Lauren Underwood, and I have the honor of representing Illinois' 14th Congressional District in the House of Representatives. I'm delighted to be joining you for this important conversation about the impacts of climate change-related risks on maternal and infant health outcomes and disparities. I am so glad to be with Senator Ed Markey, my partner on the Protecting Moms and Babies Against Climate Change Act. And I'd also like to thank all the organizations hosting today's event: A Better Balance, the Alliance of Nurses for Healthy Environments, the Black Women's Health Imperative, the Center for American Progress, Florida Clinicians for Climate Action, Human Rights Watch, Moms Clean Air Force, the National Association of Nurse Practitioners in Women's Health, and the National Birth Equity Collaborative. As your organizations know as well as anyone, the warning signs on climate change have been flashing red for decades. If the average global temperature continues to rise at its current pace, the impacts could be catastrophic. With the 2 degrees Celsius increase in coming decades, sea levels will continue to rise, more ecosystems will be irreparably damaged, and natural resource supplies will likely be depleted. But today's briefing is just an urgent reminder that climate change is not just a future danger or an abstract one. It's an immediate threat that is directly affecting people's lives right now, including our own communities in the United States. Climate change is creating new environmental health risks and exacerbating existing ones, like our nation's maternal mortality crisis, a crisis that's been worsening for my entire lifetime. The US already has the highest maternal mortality rate in the world, in the developed world, and significant racial and ethnic disparities in outcomes. Infant mortality rates are also higher for Black families and other people of color, even after controlling for variables like income. While the drivers of these trends are multifaceted, the role of climate change in fueling adverse maternal and infant health outcomes and disparities is indisputable. In June of 2020, researchers published a groundbreaking systematic review in the Journal of the American Medical Association, which assessed the effects of environmental risks on more than 32 million births in the United States. The study's authors, including Dr. Basu, who will be speaking later in today's briefing, concluded that the exacerbation of air pollution and heat exposure related to climate change may be significantly associated with risk to pregnancy outcomes, and the subpopulations at highest risk were women and birthing people of color, particularly Black mothers. As a registered nurse, I was alarmed but not surprised by these findings. My nursing education grounded me in an understanding of the role of non-clinical factors like environmental conditions in influencing health outcomes. When I served as a senior advisor at the Department of Health and Human Services, I worked on the Flint water crisis, and I saw how the disease burden of public health emergencies often takes a disproportionate toll on communities of color, a rattling reality that has been laid bare throughout the COVID-19 pandemic as well. And as a member of Congress and the co-founder and co-chair of the Black Maternal Health Caucus, the JAMA article compelled me to develop a data-driven policy solution to tackle this crisis head-on. And the result is the Protecting Moms and Babies Against Climate Change Act, which I introduced with Senator Markey in February. The Protecting Moms and Babies Against Climate Change Act would invest in community-based programs to identify climate change-related risks for pregnant and postpartum people and their infants, provide them with necessary support, and mitigate exposure to those environmental risks, particularly in communities of color. The funding supports doulas and community health workers, provides direct financial assistance to patients, strengthens community forestry initiatives, improves monitoring systems and data sharing, and prepares future nurses, doctors, and other healthcare workers to identify and address climate change-related risks for their patients. The Protecting Moms and Babies Against Climate Change Act, HR 957, makes critical investments to save lives and end racial and ethnic disparities in maternal and infant health outcomes. I'm committed to working with Senator Markey and our House and Senate colleagues, as well as the Biden-Harris administration, to get this legislation enacted. We don't have time to wait. Our moms and babies are worth it. The health of our communities depends on it, and this moment demands it. Thank you for your commitment to this cause, and thank you again for joining today's briefing. I look forward to the day that we're back together again in person, but until then, take good care of yourselves.
Thank you so much, Congresswoman Underwood. Really pleased to have you here with us. And we're going to turn to your colleague, Senator Ed Markey of Massachusetts. Senator Markey is a consumer champion and national leader on energy, environmental protection, and telecommunications policy. He has a prolific legislative record on major issues across the policy spectrum and a deep commitment to improving the lives of the people of Massachusetts and the residents of our country. He is the lead Senate sponsor of the Protecting Moms and Babies Against Climate Change Act. Senator Markey, welcome.
Well, thank you so much. And hello to everyone. Thank you for having me today. And thank you to Congresswoman Underwood for your incredibly thoughtful remarks. I'm just so proud to have you as a partner on this legislation. And we are going to make historic progress in this Congress. And I also want to thank all of today's panelists, Dr. Rupa Basu, Chief of Air Climate Epidemiology Section at the California EPA Office of Environmental Health Hazard Assessment, to Dr. Noeline Jeffers from the National Association to Advance Black Birth, Kenyatta Seeley, Policy Council at Black Women's Health Imperative, and Sarah Brofman, Director of the DC Office and Senior Policy Counsel of A Better Balance, and Dr. Camille Clare from the American College of Obstetricians and Gynecologists. So thank you all so much for everything that you're doing. Thank you for your incredibly timely and important work. In 2020, we matched 2016 as the hottest year on record. This past year, deadly wildfires engulfed the western part of our country. Sea levels continue to rise off our coast, and extreme storms and weather events wreaked havoc on our communities. The climate crisis is not at our doorstep. It is already in our homes. And as climate change makes our planet sick, so will a sick planet erode the health of its people. Hacking cough, global warming makes air pollution worse, harming our lungs. Sneezing and sniffling, climate change supercharges allergy seasons, not just storms. Heat stroke, well, a warmer future will lead to more heat-related deaths and disease. And for pregnant women, yeah, there is a big impact. Recent research has found that climate change may be associated with risks to pregnancy outcomes, with Black and brown mothers and babies experiencing disproportionate harm. The United States already has the highest maternal mortality rate in the developed world. Let me say that again. The United States already has the highest maternal mortality rate in the developed world. 17 mothers die for every 100,000 live births in the United States. And for Black and brown mothers, it's 43 mothers die. And the climate crisis will only make things worse. So according to research from Dr. Basu and other experts, women exposed are more likely to have premature, underweight, or stillborn babies. And we know what mothers live in these communities that have borne the worst impacts of the climate crisis. Who are they? Well, we know who they are. They're Black, they're brown, they're immigrant moms. We know who they are. By the way, a high percentage of them are in families that we say are essential workers, meaning they had to go to work. They couldn't Zoom to work, they had to show up to work. So we know who they are. We can see them. And actually, the pandemic shone a very bright spotlight on who these families are and who the mothers in those families are. So climate justice is racial, it's economic, and it's health justice. And our mothers, babies, and communities need us to deliver on these basic rights. We have a responsibility to protect pregnant and postpartum people and their infants. That is why I partnered with Representative Underwood to introduce the Protecting Moms and Babies Against Climate Change Act to mitigate the impacts from climate change on mothers and on their newborns. Our legislation equips our healthcare workforce and families with the resources and the tools they need to protect all of their family, but to protect themselves against the risks of climate change. Specifically, our bill would invest in community-based programs to mitigate exposure to climate-related risks. It would direct the Department of Human Services to identify climate risk zones for pregnant and postpartum people, and we know where those zones are. And it would provide funding to health professional schools in an effort to prepare the future healthcare workforce to adequately address climate change-related risks for patients. As we prioritize health and environmental justice, we must think holistically and understand the cumulative impact of our climate crisis. Many of the cities that experience high levels of pollution, like Chelsea, Massachusetts, which is just 4 miles from my house, Chelsea is the poorest community in New England. But those are the ones that are more likely to be hotter than the surrounding areas. This is due to the fact that there are urban heat islands, which can warm cities by more than 20 degrees Fahrenheit than those communities that are out in the white suburbs. But Chelsea is just one of the many cities and towns across Massachusetts, across the country, that we know have Black and brown families that continue to breathe dirtier air, experience higher temperatures, and face the dire health impacts of our climate crisis. And for too long, our government has left them without the support needed to break the cycle of injustice. I want to say this clearly. A person's health should never be dictated by their zip code, their income level, or the color of their skin. We must keep fighting to address the systemic and historic injustices our communities of color face. And this bill will take immediate steps to ensure that our moms and babies are able to see a healthy and a full future. So that's why we're here. That's what we're fighting for. And I want to commend Congresswoman Underwood and Senator Cory Booker from New Jersey for their leadership on the Black Maternal Health Momnibus Act and their efforts to end racial and ethnic disparities in maternal health outcomes. And I'm just so proud that the Protecting Moms and Babies Against Climate Change Act could be a part of this important effort. In the Senate, I'm just going to continue to fight to address racial inequities and prepare our healthcare system for the continued and escalating effects of the climate crisis. And I'm encouraged by all of the healthcare experts here on the panel who are leading the way for a more healthy, just, and hopeful future. And as I speak with you today, I am very confident that we can come together to prioritize public health, tackle the climate crisis, and combat racial injustice all at the same time. Our goal this year and next has to be to put in place the policies that make it possible that a child in America someday will have to look to the history books to find that we ever had such disparities in the American healthcare system. I can't thank all of you enough for all of the great work which you are doing.
Thank you so much, Senator. Thank you for your leadership. And now we're going to get to turn to some of the wonderful healthcare providers and scientists who are digging into this topic. We're going to start with Dr. Rupa Basu, who is the Chief of the Air and Climate Epidemiology Section at the Office of Environmental Health Hazard Assessment of the California Environmental Protection Agency. Dr. Basu's research focuses on temperature and air pollution impacts on health and identifying vulnerable subgroups. Prior to joining Cal EPA, she worked at the U.S. Environmental Protection Agency. She earned her PhD degree in epidemiology from Johns Hopkins and her MPH degree from UCLA School of Public Health. Dr. Basu, thank you for being here and welcome.
Thank you so much for the invitation today. It's really my pleasure to be here. So I'm going to present a few slides of our research, and let's see. And Congresswoman Underwood and Senator Markey already did an excellent job of introducing the type of work that I do. I'm just going to give you some examples of the work that I have done so far on heat and adverse birth outcomes, also air pollution. I'm an epidemiologist by training, which I know epidemiology has been in the news so much recently, but I'm an environmental epidemiologist. So I really do focus on these climate change impacts. So first I wanted to just show you that heat from our studies and other studies really affects all organs in humans. I know I'm going to focus on adverse birth outcomes, but I just wanted to give a little bit of a background to show that we know heat causes heat-related illnesses and dehydration, but also has been associated with cardiovascular mortality and morbidity, mental health outcomes, liver and kidney disease, gastrointestinal diseases, some respiratory outcomes, diabetes, and of course, adverse birth outcomes. And adverse birth outcomes really just in the last 10 years has really been the focus of health studies. Before that, the focus was really more on the elderly and other vulnerable populations. So as far as health research goes, pregnant women have been kind of, not really thought about as a high risk group until just very recently. So as Senator Markey mentioned, there are really three main outcomes that we looked at in our research, and that is preterm delivery, or delivery between 20 and less than 37 gestational weeks. There's also been some stillbirth studies, which in California is over 20 gestational weeks, and term low birth weight, which is less than 2,500 grams at 37 to 44 gestational weeks. But I've highlighted preterm delivery because in the next couple of slides, I'm going to focus on a study that was conducted just in, published in 2010, and it was one of the first large-scale studies of heat and pregnancy outcomes anywhere in the US. But of course, because I work for California, the study focuses on California. First, I wanted to talk about some of the mechanisms that occur. There's symptoms of acute dehydration. It could be as simple as headache or nausea or vomiting, but many times the connection isn't made between heat and dehydration. So many times you just see dehydration as a pregnancy outcome, but not really made any connection to heat or air pollution. And that's really important. Then what happens is there's oxidative stress and inflammation in the body, which releases oxytocin, and then that decreases uterine blood flow to decrease fetal growth and induce labor, often prematurely. So here's a study that I mentioned that we conducted back in 2010, and it was really the first large-scale study. But I want to just focus on this slide, and that is the disparity. We've talked a lot about the disparities, and of course, it's not surprising at all, but just to see some numbers that actually provide support to what many of us have been thinking all along, is that there is some disparity by race and ethnic group. I haven't shown here also maternal age group and socioeconomic status. And really what was most alarming is that all mothers had an increased risk of preterm delivery from heat. And this is data that we're seeing already. So for anyone who's thinking that climate change is something that's happening in the future, we are seeing these increases in adverse birth outcomes, such as preterm delivery, already with the data that we have. This is data in California. So, we have relatively mild temperatures compared to other parts of the country. Of course, other parts of the world, have some mitigation strategies that other people don't have. But still, you could see that there's quite an excess of preterm delivery. So the overall result is about 8% of an increase per 10 degree Fahrenheit increase of apparent temperature, which is just temperature and relative humidity. But what's noticeable here is that if you look at the race ethnic groups, there's Black, Hispanic, white, and Asian. And these are the groups that were kind of depicted in our, in our California birth certificate data. And Asians, we were able to it's a very diverse group, but we were able to create on our own. But you can see that whites had about a 6.6% increase versus Black mothers who had almost a 15% increase. That is quite a disparity. Also, Hispanic and Asian mothers also had 8 and 10% respectively. And as Representative Underwood mentioned, there was a systematic review published, and this is 10 years after that first study. And it really shows that throughout the US, not just that study in California, but several studies have replicated those results in air pollution and heat exposure, with over 32 million births between 2007 and 2019, showing that fine particulate matter, ozone, and heat are associated with heat, preterm birth, low birth weight, and stillbirth. And of course, the disparities were pretty consistent. And I'd like to just talk about some of the reasons for disparities and why climate change bill is so necessary. First, we've already covered some of these topics, but there's greater exposures to heat and air pollution, which we can term environmental racism or environmental justice. People who live closer to power plants, fossil fuel combustion areas, freeways, or traffic, heavily trafficked areas, urban heat island effect, which is just blacktops and less green space. So that's absorbing more heat and retaining the heat, which is really important in more predominantly urban areas. And of course, these tend to be more Black and brown communities. I have pointed out to the fact that there's also some lower socioeconomic status. There's less ability to mitigate. There's air conditioning, but maybe affordability factors into actually using the air conditioning. Oftentimes, we've seen with our wildfires in California that relocation is not feasible for everybody. So therefore, there's some disparities. But really, even with the same, there's less access to healthcare for sure, but even with the same access to healthcare, there's still some disparities. And some of the reasons could be that there's differential treatment in healthcare. Many times people say that I was at the hospital delivering my baby and nobody looked like me, nobody took me seriously, nobody really listened to my story or to my needs. And so some of the reasons, there's really not enough women, or particularly minority women who are healthcare practitioners or providing care or really advocating for equal care. And with that, I would like to leave some time for the other speakers and questions. Thank you so much. I just also want to add that I've been doing this research now for 2 decades, and it's really, while we can keep on doing this research, it's really climate change bills such as this one that really makes our work worthwhile. I mean, this is what we're aiming for. This is what we're hoping happens from taking all the evidence from our research. So thank you so much.
Thank you, Dr. Basu. Thank you for that overview of your research. We're going to turn now to Dr. Noeline Jeffers with the National Association to Advance Black Birth. Dr. Jeffers is a researcher, a certified nurse midwife, and lactation consultant with 10 years of experience providing sexual, reproductive, and midwifery care in the Washington, D.C. region. Dr. Jeffers recently completed her PhD in nursing from Johns Hopkins University School of Nursing. Through her doctoral work, she explored the impact of climate change-related hurricane events on maternal and neonatal health. Dr. Jeffers is a postdoctoral fellow in maternal child health at the Johns Hopkins Bloomberg School of Public Health. She's also an adjunct faculty member at the Georgetown University School of Nursing and Health Studies, and she maintains a clinical practice at Unity Healthcare in Washington, D.C. Dr. Jeffers, welcome.
Hi, good afternoon, everyone. So today I'm going to discuss with you the focus of my dissertation research, the impact of climate change-related hurricane events on maternal infant health in the United States and the U.S. Virgin Islands. And I do want to thank you all for the opportunity to speak about this topic. And I'm going to start today by sharing with you a little bit about hurricanes and how they are climate change-related natural disasters. So climate warming is causing the sea surface temperature to rise, and hurricanes gain or lose wind speed based on the temperature of these waters. As the water temperatures rise with climate change, hurricanes are gaining in strength. We know that even a 1 degree Fahrenheit rise in water temperature can increase a hurricane's wind speed by as much as 15 to 20 miles per hour, which is really the difference between perhaps a Category 3 hurricane and a catastrophic Category 4 hurricane. Meteorologists are predicting that the strongest hurricanes, Category 4 and 5 storms, will increase in severity and frequency in the years to come. We've already seen this occur with superstorms, Hurricane Katrina in the Gulf Coast in 2005, Hurricanes Irma and Maria in the U.S. Virgin Islands and Puerto Rico in 2017 more recently, along with other more recent storms, including Hurricane Harvey in Texas in 2017, Hurricane Florence in the Carolinas in 2018. And that's really just to name a few. So it's really clear that climate change is happening now. And one of the ways that it's manifesting are through stronger, larger, more intense hurricanes. And so I think traditionally it's been tempting to view hurricanes as sort of these unpreventable disasters. But the reality is that human actions through climate change are having a real impact on the frequency and severity of these storms. Now, this becomes even more critical when we talk about maternal infant health. In my research, I found that hurricanes represent a grave risk to the health of pregnant people and their babies. So this is what we know. So first, hurricanes cause damage and destruction that reduces the capacity of the healthcare system to adequately meet the healthcare needs of birthing people. Hurricanes cause infrastructural damage, power and water outages. As a result, hospitals may have to severely limit their services or close. Hurricane Katrina in Louisiana led to the temporary or permanent closing of several hospitals. In the Virgin Islands, the main hospital on St. Croix was partially condemned after the hurricane, and some services, even over 3 years later to this day, are still provided in mobile tents. Hurricanes also lead to the attrition of valuable healthcare providers, including nurses, midwives, OBGYNs, anesthesiologists, and more, all of whom are critical components of the maternity care team. So what does all of this mean for the pregnant person dealing with the acute aftermath of a hurricane? In the Virgin Islands, it meant that they had to give birth in a hospital with no hot water and with just one OR. In New Orleans, it meant that they were doing cesareans by flashlight. Second, I want to note that hurricanes increase stress. The damage and destruction that they cause have real impacts on people's lived experiences. Pregnant people exposed to hurricanes are simultaneously coping with managing their pregnancy, their birth, and postpartum period while dealing with housing damage, displacement, job loss, insecure housing, food insecurity, food rationing, and ultimately socioeconomic decline. In my dissertation research in the US Virgin Islands, I interviewed women who were pregnant at the time of hurricanes Irma and Maria. And the most frequent themes that emerged included narratives around the impact of stress and trauma on mental health, the frequent occurrence of post-traumatic stress disorder symptoms, postpartum depression, fears around the impact of stress on the possibility of preterm birth, and the disruption of the hurricane and on their transition to parenthood. And we care about stress because it is a known contributor to preterm birth, which is the leading cause of infant morbidity and mortality. And so that leads me to my third point about the impact of hurricanes on maternal infant health. It's really the combined impact of these hurricanes, the stress, the diminished capacity of the healthcare system that they cause, that puts mothers and babies and people at risk for adverse outcomes. Research studies have shown that hurricanes are associated with a number of adverse outcomes, such as preterm birth, cesarean birth, interrupted or inadequate prenatal care. And this is really critical, especially for Black birthing people, because Black birthing people already experience rates of preterm birth that are 2 to 3 times higher than the rate experienced by their white counterparts. We also know that they are dying of pregnancy and childbirth related causes at 3 to 4 times the rate of their white counterparts. And so these already established risks and inequities are potentially further compounded by hurricane exposure. I also want to add that hurricanes also impact infants. And the severity of the storm matters too. There's evidence that women who report that they experience severe experiences such as walking through floodwaters, having a loved one die, or being injured during a hurricane or its aftermath further increase their risk of poor outcomes, such as low birth weight and neonatal morbidity. And in cases and areas where there was a large amount of infrastructural damage, there was also found to be associated increases in fetal death as well. And so finally, I want to point out that hurricanes, like other disasters, further imperil people that are already vulnerable. One study found that among regions in Louisiana that experienced the most damage after Hurricane Katrina, Black birthing people saw a 20% decrease in very preterm births. Now, that was a curious finding. However, FEMA designated disaster counties in Alabama, areas that received many Louisiana residents after Hurricane Katrina, experienced a very similar, almost equal 21% increase in very preterm births, which provides support for the theory that, displacement and forced migration of particularly vulnerable birthing people resulted in a transfer of birth outcomes that was associated with displacement. And this was only seen among Black birthing people, right? A population that already has pre-existing race-based disparities in birth outcomes. So you have a group that is experiencing adverse outcomes at a higher rate before a disaster, being further marginalized through this disaster, through displacement. And it's just critical for us to know in what other ways are already marginalized groups being further harmed from the impact of climate change related disasters. So in summary, hurricanes are really just one example of climate change related disasters. They impact the capacity of the healthcare system. They increase stress levels. They're associated with adverse outcomes like preterm birth and cesarean section and low birth weight. And as we're thinking about mitigating these impacts, it's critical for us to think about how these impacts further entrench pre-existing health inequities and what we can do to address climate change and also address these inequities. Thank you.
Thank you so much, Dr. Jeffers, for sharing your expertise around hurricane and climate impacts and health disparities. We're going to turn now to Kenita Seeley. Kenita Seeley is Policy Counsel at the Black Women's Health Imperative. She is an attorney with extensive healthcare, corporate, and advocacy experience. She began her career in the pharmaceutical industry and worked for corporations including Pfizer, Eli Lilly, and Novartis. She is a member of the Maryland State Bar, graduated with a Bachelor of Science in Health Management Science from Howard University and a JD from the Thurgood Marshall School of Law. Ms. Seeley, welcome.
Thank you, and good afternoon, everyone. Thank you, Representative Underwood and Senator Markey, for your words, work, and leadership. I'd also like to extend thanks to my other esteemed panelists for your passion and dedication to raising awareness around climate change and maternal health. There's an alarming maternal health crisis in this country and is claiming lives at a staggering pace. Now, you've heard this statistic before, but I'm going to say it again because it needs to be said several thousand times. The situation is most severe for Black mothers, who are 3 to 4 times more likely to die from complications of pregnancy or childbirth than white women. This racial disparity persists regardless of age, socioeconomic status, education, and other factors. However, this is not solely an issue for Black women. Indigenous and Latina pregnant people also face worse maternal health outcomes than white women. Devastatingly enough, women of color also experience higher rates of preterm birth. The US has some of the highest preterm birth rates in the industrialized world. Across the US, white women have a preterm birth rate of 9.1%. American Indian, Native Alaskan women have a preterm birth rate of 11.6%, and Black women at 13.8%. Today, as a result of climate change, temperatures across the US are increasing, and heat waves are predicted to increase in intensity and frequency. This heat exposure plays a detrimental role in one's ability to have a healthy birthing experience. For Black women and other women of color, pregnancy outcomes are negatively exacerbated by climate change. Just look at the research. Studies show that Black and Asian mothers had larger impacts from heat exposure than white mothers, and that pregnant Black women had more hospitalizations due to heat exposure during their pregnancy than other women. Furthermore, we know that the health and well-being of low-income communities and communities of color is inextricably tied to the environment in which they live, work, and play. Marginalized communities are more likely to reside in urban neighborhoods that are referred to as heat islands. These areas are significantly warmer than rural and suburban communities because there are fewer trees that provide shade and more buildings and roads that capture the heat. And this is underlined by the fact that predominantly Black neighborhoods will face an average of 22 more extreme heat days per year than those with a smaller African American population. There's a growing recognition that systemic racism and public health inequalities are entwined in the climate crisis and run as powerful undercurrents of environmental and climate change impacts. Land surface temperatures in redline areas, which are neighborhoods adversely impacted by the racially discriminatory policies of withholding services, financial or otherwise, of residents who lived in certain areas based on their race or ethnicity, which is most often felt by residents in minority neighborhoods, are on average 2.6 degrees Celsius warmer than non-redline areas, and in some cities as high as 7 degrees Celsius warmer. Thus, Black birthing people and other people of color are disproportionately affected by the harrowing effects of climate change. It is important to understand that maternal health is also a part of reproductive justice. Reproductive justice involves a person's right to maintain personal bodily autonomy, have children and not to have children, and parent the children we have in safe communities. The Black maternal health crisis, which definitely includes climate change now, infringes upon those rights and can lead many Black women to severe illness, negative pregnancy outcomes, and even premature death. Previous discussions of climate change often miss or fail to center social justice concerns, even though extreme weather events, for example, result in uneven and unfairly distributed impacts hitting those with the least resources, often communities of color, the hardest. So what can be done? Support the Protecting Moms and Babies Against Climate Change Act, which centers equity, the lived experience, and legislates for education, grants, and strategies to affect change. Racial justice has to be at the center of climate and environmental solutions because people of color are the most impacted. and need to be the priority in decision-making about these issues. Our policy team at the Black Women's Health Imperative has created a foundational policy blueprint to help address the inequities that disproportionately impact Black women and girls in our nation. For more information, please go to our website. In the Black Women's Health Imperative's fight to bring health equality to all Black women and girls, we are encouraged and inspired to lead amongst the congressional membership and stakeholders today. We aspire to live in a world where everyone reaches their full potential for health, wellness, and motherhood. With the dedication, advocacy, and education here today, I know that we are poised for change. Thank you.
Thanks, Kanita. We're going to turn now to Sarah Bruhman, who's the director of the DC office and senior policy counsel at A Better Balance, where she works on legislation, litigation, and public education efforts to advance pregnant worker fairness, workplace equity and fair pay, breastfeeding rights, and to end sexual harassment in the workplace. Sarah joined A Better Balance in 2016 as a Skadden Fellow. She graduated from Columbia University and received a law degree from NYU School of Law. Sarah, welcome.
Thanks so much, Molly, and thank you to Senator Markey and Representative Underwood for your leadership on the Protecting Moms and Babies Against Climate Change Act, and a big thank you to my fellow panelists and your organizations for all your work and advocacy and research. At A Better Balance, we focus on advancing justice for workers so they can care for themselves and their loved ones without compromising their economic security, with one of our main focuses being on providing support for pregnant workers. And we have two strategies that I'm going to mention today among many. One is making sure we have strong laws that are protecting and working for working families. And the other is talking with workers themselves. And a big focus of ours is working directly with pregnant workers. And to do that, we run a free and confidential legal helpline where anyone can call us if they have questions about caregiving and the workplace. And one of the workers we recently heard from was Tasia Buckles. Tasia called us because she worked in the hottest part of a retail store. She's a low-wage worker, and she was working at the hottest time of the year. And through A Better Balance's free legal helpline, we've heard from many workers like Tasia. Tasia is going to share her own story, so I'm not going to share it for you because she can speak in her own words. But what I will say, and to provide some context, we hear from workers like Tasia all the time, workers who work outdoors in agriculture or farming, and they work outside and they're pregnant and they need accommodations to take more rest breaks or to get more water. We talk with workers who work in warehouses that are extremely hot and they have few breaks and are not allowed to take breaks to go to the bathroom if they need to, or to even have a glass of water. A common occurrence that we hear is, that a lot of companies have, very strict food and drink policies. Even workers aren't even allowed to carry sometimes water bottles on the retail floor. And we've heard from workers who have fainted from dehydration because they worked in very hot environments where they weren't even allowed to carry water on the floor. Which brings us to the Protecting Moms and Babies Against Climate Change Act, because the climate crisis is impacting all areas of life. We've heard from our speakers about all the ways in which the climate crisis is impacting. And one of those ways is in the workplace. At A Better Balance, like I've mentioned, we focus on ensuring workers can care for themselves and their loved ones without compromising their economic security. But the climate crisis is often an impediment to remaining healthy at work. That's why the bill considers many social determinants of health. And when we consider social determinants of health, we must consider and address, including how the climate crisis contributes to barriers in the workplace for pregnant workers. And we know this issue is disproportionately impacting low-wage workers, often disproportionately women of color. And it's why we need comprehensive legislation like Senator Markey's and Representative Underwood's that considers the issue from all angles and all aspects of life, including the workplace. And I'll just mention, because Tasia raises it in her remarks as well, that we also need other legislation like the Pregnant Workers Fairness Act. That's a bill that passed the House not 2 weeks ago with very strong bipartisan support and would require employers to provide accommodations for workers unless it causes an undue hardship. And with a PWF, with a Pregnant Workers Fairness Act, Tasia may have been able to transfer to a different job where she could have been cooler and wouldn't have experienced what she experienced. And you'll hear her share that in just a moment. Or it would allow pregnant workers to get more bathroom breaks. It would allow workers who work outside potentially to have more rest breaks or more water breaks. So I will turn it over now to Tasia to share what happened to her. And I hope it provides just a small example of what so many pregnant workers and pregnant people are facing, and just a small sliver of why we need to address the climate crisis vis-a-vis maternal health, specifically with Senator Markey and Representative Underwood's legislation.
Hello, my name is Tasia and I'm from Missouri. So today I will be speaking about my experiences while being pregnant in the workplace, and also my experiences about working during a pandemic. So I found out that I was pregnant early March of 2020, and I had told my manager, my store manager, and my personnel associate that I was pregnant, and I was about 5 weeks along at the time. I told them I wanted them to know sooner rather than later, so if I needed any accommodations, they would know why, and also they couldn't deny me those rights. So I didn't really need accommodations until about April, and I started to become very dizzy and nauseous. And I had asked them if I could have a water bottle to kind of help with that, just near my workspace, and they refused me that. And I had also asked if I could have a temporary transfer out of my position because it was very hot. We were in one of the hottest parts of the store, and I was nearly fainting every day, and they denied me that right as well. I never expected to be treated that badly, so it really threw me off. I thought because the conditions were kind of bad with the heat, the slick floors, and there were multiple COVID cases going around, that things would be different and I would be accommodated, but I wasn't. So with all of my accommodations and temporary transfer being denied, I had asked, like, hey, what am I supposed to do if I can't do my job physically? I can't keep from fainting. I can't really control it. So what am I supposed to do? And they told me that I would have to take unpaid leave or I would have to quit. Well, I had already taken unpaid leave because of COVID. I talked to my doctor a few weeks before that and had asked what I should do. And she said because I was in an immunocompromised state already, that they didn't really know how it affected COVID, but it should be safe just to go ahead and take the unpaid leave, just to be careful. So I had explained to them that I wasn't able to take unpaid leave again because I wasn't going to be able to afford it. And they just said my only other option was to quit. So I decided that it would be best for my health and the health of my child to quit my position. And this caused my financial situation to be entirely different. I wasn't able to save money like I had planned because, as we all know, children are very expensive with the diapers and formulas and the many other things that they're going to need. It adds up over time. And I also wanted to move into a house so we could, have more space out of an apartment. So that really put those plans to a halt. I had also wanted unemployment benefits, so I applied for that and I was denied because they said that I had quit. I wasn't able to get those benefits because it wasn't a good enough reason. So I'm speaking out today because I don't want anyone else to go through what I've been through, having such simple accommodations denied and your plans to just flip on you all of a sudden. It takes a toll on you and it adds to the very many stresses of pregnancy that you already have. And as we all know, stress is not good to have during pregnancy. It's not healthy for you and it's not healthy for your child. So a law like the Pregnancy Workers Fairness Act would really help everyone around us, and it would make my situation different because I wouldn't have been denied my accommodations, and I also wouldn't have been forced to take unpaid leave or quit. So it's important for workers like me to speak out and to be listened to and heard, because if nobody's going to speak out about it, nothing's going to change. So I hope that me giving my time today would give you guys a lot to think about. So thank you for listening to me.
Still really powerful story. Thanks for sharing it with this group. So thank you so much, Sarah. We're going to turn now to Dr. Camille Clare. She is chair of the Department of Obstetrics and Gynecology at SUNY Downstate Health Sciences University and professor in the College of Medicine and School of Public Health. She's a board certified obstetrician and gynecologist, and she serves as the District 2 chair for the American College of Obstetricians and Gynecologists. Dr. Clare, welcome.
Thank you, everyone. Good afternoon, and thank you for giving me this opportunity to contribute to this important conversation. Thank you to Representative Underwood as well as Senator Markey for their work in this area, and the policy colleagues and research colleagues that preceded me. As already mentioned, I sit on the board of directors for the American College of Obstetricians and Gynecologists and represent about 5,000 OBGYNs in the state of New York. I have dedicated my career to supporting patients having happy and healthy pregnancies and births, and to addressing racial and ethnic health inequities that disproportionately harm my patients. As you've already heard repeatedly today, the United States is in the midst of a maternal mortality crisis, and particularly for Black maternal health, this is especially important. This is multifactorial and definitely requires multifactorial solutions, which is why the Black maternal health Momnibus is so important, because it approaches this critical issue from many different directions, including addressing the impact of climate on maternal health outcomes. ACOG is proud to endorse the Momnibus, and I'll explain to you why. As my fellow panelists have enumerated, there's a growing body of evidence that you've already heard, finding that climate change, in particular extreme weather events, is associated with adverse pregnancy outcomes. And just as the maternal mortality crisis disproportionately negatively impacts Black birthing people, research particularly repeatedly confirms that's also the case for the impacts of climate change and extreme weather events. I've spent my career working in urban areas and serving patients from underserved communities, including 20 years practicing in East Harlem and currently practicing in Central Brooklyn, where the impact of poverty and social determinants of health on my patients, including access to housing, clean air, really unquestionably impact their health outcomes, and has been exacerbated in particularly by the COVID-19 pandemic. A survey conducted a few years ago by physician members of the National Medical Association, which I also am an active member, found that 80% of the African-American physicians who responded to the survey report that climate change affects their patients in some way. The biggest reported impact of climate change on patients include severe weather-related injuries, increase in chronic diseases related to air pollution, and heat-related illness. And not surprisingly, those that are reported by physicians that are disproportionately impacted by climate change includes those patients with chronic health conditions and people living in poverty. So I'd like to share the patient's voice and examples for the patients that I've seen. I had a particular patient who came to the labor and delivery area. She was 30 weeks pregnant. She had severe asthma. She was living in a low-income housing and really was impacted. She needed to be admitted to the intensive care unit because of the effects of her asthma. So this is really just one example of a patient's story, and I'll share another one in a few minutes. We can really see that the direct physical impacts of extreme weather-related events on my patients are of equal importance as the indirect impacts of these events. You've heard from my colleagues regarding hurricanes in particular. When Hurricane Sandy hit New York City in 2012, that happened to be on my birthday, so it's extremely memorable to me for many reasons. It forced the hospitals in the area to close and evacuate patients. The hospital where I was practicing at the time received the emergency transport of several critically ill postpartum patients, which really created a lot of stress and confusion for those in the community. It negatively impacted their access to care care, especially those who are pregnant. I had a patient in particular that had a mass in her throat that ended up being cancer. She was pregnant. And again, that delay in care just from hospital closure due to the impacts of Hurricane Sandy were really significant. So for all of those reasons that I outlined, hopefully I've illustrated for you the example that my patients have told me that I've experienced in taking care of my patients. These reasons are why the American College of Obstetricians and Gynecologists are so supportive of protecting moms and babies against the Climate Change Act, and we encourage its swift passage. And thank you again for the opportunity to join my colleagues today, and I look forward to your questions. Thank you very much.
Thank you so much, Dr. Claire. Really important to hear your clinical perspective and really appreciate you being here with us today. What an amazing group of speakers. Thank you to all of you for bringing your expertise here. And I'm going to turn now to my colleague, Haley Duncan, to see if there are questions that we can direct to our panelists. Haley?
Hi, Molly. We do have a couple of questions. So the first one we have is from, sorry, I lost my space. Well, this question is from me actually, and kind of everyone on the moms team. We were wondering what the current status of the Protecting Moms and Babies bill is, if it needs more co-sponsors, and this question will be directed towards the wonderful staffers from Representative Underwood's office and Senator Markey's office, who stayed on to answer questions for us.
Thanks, Haley. So we'd love to, I don't think the Congresswoman and the Senator were able to stay, but their staffers are here. We'd love to hear from them on the status of the bill.
I can turn it over to my colleagues in Senator Markey's office if they want to go first, maybe on the Senate side, and happy to add some details from the House side as well.
Sure. Thanks, Jack. And thank you everyone for this panel. I mean, to the point about co-sponsors, we can always use more co-sponsors. We've got 4 terrific co-sponsors in the Senate right now: Senator Merkley, Senator Blumenthal, Senator Sanders, and Senator Bennett. You know, that is a great list of folks. The more folks we can get on board on the Senate Help Committee, Health, Education, Labor, and Pensions Committee, the more chance we'll have at getting it through some kind of committee process. And then, of course, we're also always trying to see ways, if we do have a reconciliation process, to provide more funding to these kind of really important programs. So moving through regular order or through reconciliation, we'll be fighting for this hard. And I know Jack is also working on the broader Momnibus, so I'll pass it back to him.
Thank you so much, Hannah. Yeah, and I would really echo that here on the House side. The House bill is referred to the Energy and Commerce Committee. So in addition to getting as many co-sponsors as we can broadly, really a heavy focus on energy and commerce members and continuing to build support for the legislation. So, you know, between the House and the Senate, there are plenty of opportunities to weigh in, and we've just been really grateful for all of your organizations for all the advocacy that you've done and support you've built for the bill.
Thanks, Jack. Thanks, Hannah. Thanks for staying on the call. Haley, do we have other questions?
We do, and I'm just looking at the clock, and maybe for the sake of time, everyone's time, we will ask one more question. So this question comes from Molly Michael, who is a former doula, and her question is, as a former doula, she's a former doula and did what she could to be an advocate for her clients during their prenatal, birth, and postpartum periods. She helped them advocate for themselves and their well-being, but many of her clients were people of color and were treated poorly and received more aggressive interventions during their birthing processes. She's wondering what we can do, or what people can do to tackle this maternal health inequity. And I think that this would be a great question for anyone who's willing to take it on. And thank you, Molly, for your question.
Maybe I'll turn to some of the healthcare providers in clinical care who want to address that. Dr. Claire?
Thank you for that important question. I can tell you that some of the efforts that we've done in New York State, and it's really been duplicated throughout the country, we've done some work with the New York City and the New York State Department of Health in collaboration with ACOG District 2, looking at respectful standards of care at birth. And some of those standards really help us elevate the patient's voices. This was a document that was created through the Department of Health in collaboration with several stakeholders to really address the community voice and making sure that we're hearing what the patients are looking for in the clinical arena, in the hospital arena. And so those are one of the things. There are many, many different other efforts that are done through the hospital, through ACOG, through departments of health throughout the country to really address hearing the patients and making sure that their birth experiences reflect what they wish. So hopefully that answers that excellent question from the participant.
Thank you. Dr. Jeffers, did you want to add anything to that?
Yes, absolutely. So at the National Association to Advance Black Birth, we've actually developed something called the Black Birthing Bill of Rights, which is a set of 20 evidence-informed rights that we have been publicizing and spreading mainly through social media at this time. But it's really a set of rights that serves to provide people with a framework for understanding, hey, what is the level of care that I should be receiving from my providers, who can accompany me at birth. I should have what sort of rights in this process of receiving prenatal, birth, and postpartum care. And so I would definitely recommend, I wish I don't have it pulled up at the moment, but if you search Black Birthing Bill of Rights from the National Association to Advance Black Birth, you will actually see that we've outlined what hospitals, what healthcare providers should be offering and upholding and honoring in terms of the care that they're providing for Black birthing people. So I definitely recommend that you utilize that. We are also trying to have healthcare providers sign on saying that they are committed to honoring these rights for Black birthing people. And we're also trying to work with hospitals as well to get in there, train hospitals, let them know, hey, these are the rights that should be afforded to Black birthing people. And they really outline anti-racist care, respectful care, compassionate care, and providing people with the support that they need so that they can have positive and empowering pregnancy, birth, and postpartum experiences. So Black Birthing Bill of Rights.
Thank you, Dr. Jeffers. So unfortunately, we are out of time. What a wonderful conversation, an incredible group of panelists. I want to thank, in addition to Representative Underwood and Senator Markey and their staff, I want to explicitly thank again our panelists, Dr. Rupa Basu, Dr. Noeline Jeffers, Kenita Seeley, Sarah Brathman, and Tasia, their advocate, and Dr. Camille Clare. Thank you so much, and thank you to the partners who pulled this together. Have a wonderful day.